Good afternoon, colleagues, and thanks, million, for your kind invitation to contribute to this interesting discussion on active and healthy aging. So my name is Stacy Gamanos, and I'm the director of an organization called Eurocarers. We are based in Brussels, and we have member organizations across Europe. So currently 77 member organizations in 26 countries, including Greece, of course, so Epion is a member of our network. And our mission is to be the voice of informal carers across Europe. So we work closely with the Commission and the European Parliament, but also with WHO Europe, the OECD. And thanks to our network, we also collaborate closely with public authorities at national, regional level. So today, my job is actually to have a slightly different focus. My job is to give you an overview of the way active and healthy aging is approached at European level. And in doing so, I will also take the opportunity to say a few words about the recently launched EU Care strategy, which I think offers quite a lot of potential for all of us to advance our respective missions wherever we work and operate. So let me share my screen quickly. Just 1 second. Go, it's coming. Yeah, hopefully you are seeing my screen now. So first of all, let me say a few words about the context in which, against which we operate. So first of all, I suppose, as we all know, people in Europe tend to live longer and healthier than ever before, which is, of course, extremely good news. So just to illustrate this, the number of people aged 65 or over will are expected to grow by 38% by 2050, according to the European Office of Statistics, Eurostat. So currently, the number of people above the age of 65 amounts to 94.3 million people, and that will increase to 129.8 million people by 2050. Again, just to give you a sense of the size of that population. So the number of people above the age of 65 currently represents 21% of the population. That will increase to 29% by 2050. So that's a pretty substantial growth there. The number of 80 plus, so obviously the age strand where people are more likely to experience long-term conditions, is also projected to more than double by 2050. Currently, the proportion amounts to 6% of the population, so the number of 80 plus people, and that will more than double by 2050. Finally, the number of centenarians in Europe, which currently is around 100,000 people, will be close to 500,000 by 2050. So again, a very, very substantial growth. So obviously, as you can imagine, all of this generates quite a lot of challenges for all member states across Europe, because obviously the increasing life expectancy and the aging population also means that age-related and chronic conditions have become or will become even more prevalent, and that will result of course in a growing demand for care. The problem is we are also facing, parallel to that, a declining supply of care because of staff shortages in many care professions due to inadequate working conditions, so very bad working conditions, so low pay, bad working hours, the fact that also many care professionals don't have access to adequate training, or because of fast evolving care practices and technologies. And all of this combined means that our care systems for all member states across Europe, and even beyond that across the continent, I would say, are also facing sustainability and quality challenges that our public authorities are really trying to address. I should also add that in many member states, there's also a fragmentation of care. And what I mean by that is there's a disconnect, a lack of coordination between healthcare and social care. And even within healthcare, again, a lack of coordination between primary care, so general practitioners, nurses, pharmacists, physiotherapists, and specialist care. So these levels of care do not really speak with each other as they should. So that could also be improved. And the byproduct of all of these issues, of course, is the fact that in the majority of member states, care systems tend to rely or over-rely, I would say, on informal carers, so family members, friends and neighbors, which is, of course, at the core of our mission, and we're trying to address that and rebalance the distribution of care responsibilities between public services and families. So what needs to be done? As I briefly highlighted before, we clearly need to boost the integration of care services, and in particular at community level. And what I mean here is the need to improve and enhance the coordination and collaboration of care services and providers. And that involves making sure that different aspects of care, such as primary care, specialty care, and social care, work together seamlessly to provide more comprehensive and more effective care for patients. We also need to work on the workforce development and training because of the challenges I indicated before. So we need to address the shortages, attract new people to the care professions, and improve working conditions and training, of course. Thirdly, we also need to enhance home and community-based care, and there the objective or the idea is really to improve and enhance or expand services that allow individuals to receive medical and social care in their own homes and communities for as long as possible, rather than in institutions like hospitals or nursing homes. And this for various reasons. First of all, research demonstrates that a majority of people would prefer to remain at home and receive care at home for it as long as possible. And that's my personal preference for sure. And I'm sure it's a preference for many people in the room. But in addition to that, except for the provision, in the case of the provision of intensive care, institutional care is much more expensive in the majority of cases than home care. So obviously there's an economic dimension to it as well. Fourthly, the question of innovation and technology. I think all of us have been involved in discussions or have come across scientific articles about the growing role of innovation and technology, so ICT-based solutions, and artificial intelligence in the context of care and caring. Our message on the topic is the fact that ICT-based solutions are extremely important to alleviate the burden of informal carers, to improve the performance of care professionals, but ICT-based solutions and AI-based solutions should only be one tool in the toolbox and not replace the entire toolbox, of course. And then last but not least, because obviously this is the core of our conversation today, the need to invest in active and healthy aging. And here what that means is essentially to invest in prevention, because obviously prevention is always better and more effective than cure. So here the idea is that living longer in Europe does not necessarily mean living healthier. So we need to address the elements, the drivers of negative health outcomes in Europe. So through public health, health promotion, disease prevention. But by extension, we also need to create an age-friendly environment. So an environment which allows us to age in better conditions throughout the life course. And that concerns not only policies and measures in the health and care sector, but all the other policies that ultimately will have an impact on the way we age and on our health outcomes. So, for example, urban planning, education, social equity, and things like that. So coming back or coming now to the EU instruments at our disposal to to make progress on all of these topics in our respective countries and regions. Sorry. Let me start with the European Care Strategy, which was first announced, quite frankly, very much to our surprise, in September 2021 by President von der Leyen in a State of the Union annual address. The objective of the care strategy is to address both carers and care recipients from childcare to long-term care, even though, of course, we focus primarily on long-term care, and to guarantee access to good quality and sustainable care services for all throughout the life course. So the life course perspective here is extremely important. And the strategy is important for one main reason. It sets, for the very first time ever at European level, it sets an agenda for policy reforms and calls on all member states to boost access to quality, affordable and accessible care services while improving working conditions and work-life balance for both professional and informal carers. So it is a set of targets, objectives that we can all use to put pressure on, quite frankly, on our governments to say, okay, if you want to respond and implement, transpose adequately and effectively this EU care strategy, we can help. So in our respective roles, we can inform the transposition of the care strategy. Now, importantly for the work of the organization I represent, of course, the strategy explicitly acknowledges that professional care and informal care go hand in hand. And so the key question for us in the future consists in defining what is the adequate balance between publicly funded and provided professional care and the role of families, friends and neighbors in the care mix. Because obviously, as I said earlier, currently many member states tend to rely primarily on informal care, unfortunately. So here you have an overview of the topics captured or addressed by the EU care strategy. So accessibility and affordability and quality of care, adequacy of care, because obviously the idea is also to ensure that besides the need for an integrated approach to care, we also need to increase the offer and provide a balanced mix of long-term care services in all care settings, such as home, community-based and residential care. And we also need to make sure that care is accessible, for example, outside working hours and even in rural areas. And then there's a strong focus also on the need to improve working conditions, as I indicated before. You can find all the documents related on to the EU care strategy on the Commission's website. And of course, you should not hesitate to contact Eurocarers if you need more information about this. When it comes to, again, the specific focus on informal carers, again, bear in mind that the strategy also calls on member states to identify informal carers in all member states, in all countries, to improve the collaboration between informal carers and care professionals, and also to provide informal carers with the support measures they need to provide better quality care while maintaining their well-being and quality of life. That includes training, counseling, healthcare, psychological support, the possibility to take a break from time to time, and also, very importantly, the need for them to have access to some sort of financial support. Now, when it comes to active and healthy aging, the Commission and EU institutions generally have been extremely active in the last, let's say, decade. But as far as I could see, that kind of declined in the last few years, certainly since 2020, probably because the pandemic has drawn the attention of policymakers elsewhere. Having said that, the priorities in the field of active and healthy aging have been well defined by the Commission and through its various initiatives. So the first one at the top there is the need to keep people active for as long as possible. And that includes the promotion of part-time or voluntary work and hobbies as a way of maintaining a good level of health and well-being. Then the second priority is to ensure and strengthen social networks. So the promotion of, for example, older people's clubs, the role of family and friendship, of relationships, and so on. Thirdly, the need to promote lifelong learning as a way of maintaining a good level of health and mental health, obviously some level of activity, but also to improve the employability of older people. So as you know, because of the economic dimensions I briefly mentioned before and the need to sustain our care systems, we are expected now to work for longer. The pension age has been increased in many countries, and so it's important to maintain the employability of older people as well. Fourthly, the need to promote healthy habits, so eating habits, but also physical activity, the need to address the drivers of negative health outcomes, so smoking, bad diets, unhealthy food and things like that. So walking clubs, cooking clubs targets older smokers, alcohol abuse, and so on. And then finally, the need to ensure financial security as we age, which is also an important determinant of negative health outcomes. So the need for older people to continue to have access to an adequate income to ensure an adequate standard of living. So these are the key priorities in the field of active and healthy aging. So just to conclude, I want to draw your attention to the fact that even though the Commission and new institutions in the last few years have become a bit less, let's say, active, they're less at the forefront of these topics, at least in my opinion. The WHO is extremely active on the topic as part of their UN Decade of Healthy Aging, which is an initiative they launched to accompany the last 10 years of the implementation and promotion of the Sustainable Development Goals. So again, you will find more information about all of this on the WHO Europe website. But basically, in terms of the action areas, as you can see there on the slide, the idea is to address ageism. So the way we perceive age as as a barrier to the social inclusion, or to employment, for example. So discrimination related to age is essentially what I'm trying to say. The need to develop, again, coming back to promotion, the need to develop age-friendly communities, the need, again, to integrate care services, both health and social care, and and the need to boost the provision of good quality long-term care for everyone across Europe. Now, this gives you a very brief overview of the situation, the priorities, and the tools available to us to make progress in our respective fields around active and healthy aging and long-term care. I hope that has proven useful. If you need more information, you can find that on our website, or of course, you should not hesitate to contact me as well. Thanks again for your attention and your invitation, and I wish you all a very productive meeting. Thank you.